I'm Lisa Ballard. I'm a health psychologist and a research fellow at the University of Southampton. I'm working on a project where we're analysing data from patients that are thinking about or deliberating a decision to have a test for Huntington's disease. So Huntington's disease is a disease that if you get, there's no real kind of cure or treatment. And if you're tested for the gene, so if you're found to have the alteration, you will get Huntington's basically. And so in the project, we were collecting data from consultations, from interviews, but also we were collecting data from reflective diaries. So participants were recording their thoughts between the three consultations they'd have. And so I was looking at those diaries. So it was full lockdown. I was working at home just like everyone else. And I also live on my own, and I hadn't quite anticipated, because it's kind of secondary data, it's not like an interview I've conducted or a consultation I've sat in, so I would have known the data. I just kind of thought, right, let's start looking at the diaries. And actually I found reading the diaries and coding the diaries incredibly distressing. And that's something I've not really experienced before. I've been a researcher for quite a long time, and I had quite a few different kind of genetic conditions to look at and things like that. But the content of the diaries was quite raw. It wasn't anything like the consultations. It wasn't anything like the kind of conversations that these patients were having with their clinician. It was just their thoughts, and people were talking about, if I've got Huntington's and if it gets to this point, this is how I will commit suicide. They were discussing, they had family members as well that had Huntington's, and the experience of caring for the family member or how the family member progressed through their disease. And my reaction to the content of the diaries completely took me by surprise. And it's something that I then have subsequently shared with the team, and it's something that we've never really thought of before. So when we're kind of filling in ethics applications for research projects, we think a lot about the participant well-being, and we want to leave the participant as well as we left them or better. And make sure it's not distressing, there's support in place. But I've been involved in quite a lot of ethics applications, and I can't think many times we've really thought about the researcher and the researcher well-being. And as a psychologist, it kind of makes me think, why haven't I thought about this before? I'm quite, desensitized, I guess. I work in a hospital, on a hospital site. I'm a member of a clinical ethics committee where quite distressing cases are often discussed. And I've been working in this area a long time. And also I've been a behaviour change specialist where I've been helping people out in the community that also talk about suicide. So it's not a topic I'm unfamiliar with, but I think it was a combination of things really. So myself, I was quite anxious through lockdown. I'm a sociable person. I work in a team of other researchers, a multidisciplinary team of like medical doctors, sociologists, psychologists, and all of that was kind of stripped away during lockdown for us all really. So I was on my own, and so the anxieties of just the lockdown and the unsettling feelings, and it really did take me by surprise. And I'm thinking like, this might be a way that we're going to be working for a long time. We're going to be working from home for a long time. And, what if there's another pandemic? And these are the kind of, and what about if these are things that have been affecting researchers, but we haven't really been talking about them? And then I started looking at the literature, and it is something that people are talking about. So I came across a term called vicarious trauma. So it isn't something new. Of course, people are doing research on really traumatic things. But it was a particular combination of lockdown. I didn't know what was in the diaries. I hadn't collected that data myself. It was secondary data, and I guess I just hadn't put these things together. And the people I'm working on the project, we hadn't really anticipated that. When I was a practitioner, now I'm purely research. I don't see patients, but I worked for 8 years in a service where I saw patients, and we would have kind of clinical supervision. And also the genetic counsellors I kind of work quite closely with, they have clinical supervision. But as a researcher, there's no formal kind of alternative. And so I'm wondering whether that's something maybe we build into your role as a researcher is that you, at maybe at particular points in your research project, you get someone that you could have clinical supervision with, so you can discuss, what participants are discussing with you.